Here are my top 5 treatments for Morton's neuroma. 1. Proper shoe fit. The majority of patients that I see actually are wearing shoes that are too narrow. A Morton's neuroma is caused by pinching of the nerve between the bones at the ball of the foot typically. I have patients do what I call the insole test. If you pull out the factory inner lining of a shoe, stand on it. If the bones at the ball of your foot splay beyond that inner lining, we know your foot has to squeeze into a shoe. Unfortunately, so many of us are used to that feeling, but it is not normal. The second treatment is what we call a metatarsal pad. These are little skived felt that we put right before the bones at the ball of the foot. What this does is 2 different things. It equalizes the pressure point between the middle of those bones and the ends of those bones, where typically we're putting pressure only to the ends. And it also helps to splay the ball of the foot more. So again, instead of our bones being like this, we walk on this pad and it actually does widen what space we have in between there. It's still tethered by a ligament, but it does help space. That's the whole idea, is we're just trying to create rest in between where that nerve is. The third treatment I recommend is a rocker soled shoe. Thankfully, there's tons of brands now out there that really execute this well, but it's where the forefoot has a rocker. So when we walk heel to toe, instead of needing to bend about 60 degrees is what we define as normal big toe joint motion, instead of needing to bend through there as we go into propulsion, we allow the shoe to do that work for us. So we go through that motion, and then our toes can essentially be rested, and that extra pressure where that Morton's neuroma is not exposed and is not painful. The fourth treatment is calf elongation. 70% of issues we treat in the foot is related to a tight calf. The nerve should sit below the levels of the metatarsals. However, when we have an increased newtons of force to the ball of the foot as we walk specifically into propulsion, that nerve gets pushed up into the space between those bones, and that's where the problem comes. There's mechanical irritation that then scars the nerve. So if we can lengthen the calf, then we will have the nerve sit below those bones once again and not in that pinch point. The fifth Morton's neuroma treatment I recommend are toe spacers. So whether someone has toes that are truly just too close together, which most of us do, or those with a bunion, which actually I find that a lot of patients with a bunion, their neuroma is actually due to the pinch point between the bases of the toes. All patients with neuromas benefit from that spacing, whether it's due to truly taking off the direct pressure or stretching by pulling on those branches that connect to the neuroma to move it more distal. Ultimately, we're talking about a scarring condition. So when we can try to pull through those adhesions, that's always going to be beneficial. Brands I recommend include correctos that actually are meant to be used as we're strengthening our intrinsic muscles walking around. I use mine in Ultra sneakers, for example. The other option would be using yoga toes just as stretchers, but both can be very